All right, so today we're going to try to tackle something pretty pretty important, I think.
Mm.
And that's how our bodies, they can react in ways we don't always expect, especially when it comes to medical situations, right?
Oh,
I mean, it can be kind of overwhelming trying to keep up with all the medical info out there.
oh, absolutely.
So what we've done is we've pulled together a bunch of info on stuff like what happens when your blood pressure suddenly changes, different heart conditions, even strokes, all that kind of stuff.
Yep.
And the goal here isn't to like turn everyone into a doctor or anything, right?
Wow.
It's more about giving you the essential like need to know stuff so that, you feel more informed and maybe a bit more prepared. God forbid something happens to you or someone around you.
I think that's a great way to put it.
So we're going to be looking at things like hypotension, which is basically, low blood pressure.
Right.
Then there's hypertension, which is, well, the opposite, high blood pressure.
The classic pair, right?
Yeah, exactly.
We'll be looking at ischemic heart disease, which includes, things like angina and heart attacks.
Oh, wow.
Then we'll cover congestive heart failure, cardiac arrhythmias, infective endocarditis, and
That's a mouthful.
it is, yeah, cerebrovascular accidents, or as most people know them, strokes.
Right.
So, yeah, we want to try to give you a clear picture of what all these conditions involve, what are the signs, the symptoms, what you should be looking out for, and some important things to consider, management and that kind of stuff.
Okay, great. Yeah, let's unpack all of that, starting with hypotension.
Okay.
Low blood pressure, right. So what is that exactly? What are we talking about here?
Well, our sources define hypotension as a blood pressure reading below 90 systolic.
Systolic being the top number.
Yes, exactly. The top number when your heart beats.
Okay,
And 60 diastolic, which is the bottom number when your heart rests.
gotcha.
Now, it can also be defined as a sudden drop from someone's usual blood pressure.
Oh.
So that would be like a drop of 20 points on the systolic or 10 on the diastolic.
Interesting. So it's not just about like an absolute number. It's also about like how much it changes.
Exactly.
That makes sense.
Yeah.
So who might be more prone to this? What kind of folks should we be thinking about?
Well, the information that we've got points out a few specific groups of people.
Okay.
People who already have hypertension, so people with high blood pressure, they can sometimes experience these episodes of low blood pressure,
Oh, that's interesting.
which, kind of seems counterintuitive, right?
Yeah, you'd think it'd be the other way around.
Yeah, you would, but then also individuals who've had like lengthy procedures or appointments, and really anyone experiencing a lot of stress could be more susceptible to this kind of a drop in blood pressure.
So it really is kind of all over the map then.
Yeah, it can be.
Okay.
Yeah.
So let's say, you're in a situation and you think someone might be experiencing hypotension. Like what are the things you should be looking for?
Right. So the sources, they provide a whole list of signs and symptoms to watch out for.
Okay.
And these include feeling lightheaded,
Okay.
actually fainting, passing out,
Oh.
a noticeable rapid heartbeat,
Mm-hmm.
blurry vision, feeling nauseous,
Okay.
unusual fatigue.
Mm-hmm.
Someone with low blood pressure might also seem kind of confused, complain of chest pain, or their skin might feel cold and clammy.
Right. Yeah. So basically, if you're seeing any combination of these things, it's a sign that something could be wrong.
Exactly, yeah.
And what do you do? Like if you observe these kinds of signs, what are the immediate steps that should be taken?
So the first thing that's recommended is to help the person slowly return to an upright sitting position in a chair,
Okay.
and then assist them as they leave.
Right.
It's really important also to watch for what our sources call trouble signs.
Oh, trouble signs.
Yeah, things like a rapid heartbeat that gets even faster when they try to sit up,
Okay.
continued lightheadedness if they look really pale, seem confused, feel nauseous, or complain of dizziness.
Got it. Yeah.
So if these trouble signs are present, the advice is to postpone any kind of non-urgent care,
Yeah. Better safe than sorry. Right.
Yeah, exactly. Yeah.
Okay. So that's hypotension, low blood pressure. Now let's flip it around. Let's
Okay.
talk about hypertension or high blood pressure.
Right.
So what are we talking about here? What's the definition?
Well, hypertension is defined as a sustained elevation of systolic and or diastolic blood pressure.
Okay.
The information we have, it emphasizes that it's a major risk factor for both heart and kidney problems.
Mm-hmm.
And critically, if it stays high and untreated for a long time, it can be fatal.
Yeah, that's the scary thing about high blood pressure is that, I think a lot of people don't even realize they have it for years. you know?
You're absolutely right. That's a really important point.
Yeah.
Our sources highlight that individuals with hypertension, they might not experience any noticeable symptoms for a really long time, but during that time, this sustained high pressure can be silently damaging those vital organs, like the kidneys, heart, brain, and eyes.
Yeah, it is scary to think about something that dangerous, happening without any obvious signs.
Yeah.
So how common is it? I mean, who's statistically more likely to experience hypertension?
Well, the likelihood of having hypertension, it really goes up with age.
Okay.
Our sources indicate that over 65% of adults in America aged 60 and older have high blood pressure.
Wow. That's a huge percentage.
It is. It's also noted as being more common in older generations overall, and there are some disparities among different groups.
Oh, really?
Yeah, so for example, it's observed more frequently in Black individuals compared to white, Asian, and Hispanic Americans,
Interesting.
and also more often in men than in women.
Okay. Are there particular lifestyle choices that can contribute to high blood pressure?
Yeah, absolutely.
Mm-hmm.
Several lifestyle factors are identified as playing a significant role in the development and progression of hypertension.
Like what?
Well, things like being overweight or obese,
Okay.
drinking too much alcohol,
Mm-hmm.
having a diet that's high in
Oh,
sodium.
right. Salty foods.
Exactly, and not getting enough physical activity.
Okay, so basically, living a healthy lifestyle can really make a difference.
It really can.
Okay, so what are some of the key signs and symptoms that might suggest someone has high blood pressure?
Well, while many people with hypertension are asymptomatic, as we mentioned earlier,
Right.
the sources do list some potential signs and symptoms.
Okay.
Things like headaches,
Right.
feeling nauseous, dizziness, chest pain, vomiting, confusion, nosebleeds, feeling anxious, a buzzing sound in the ears, difficulty breathing.
Wow, so it's a lot of things actually.
It is.
Okay, and an irregular heartbeat and blurred vision or other changes in eyesight as well?
Mhm.
Okay, now when it comes to managing hypertension, particularly in, like a healthcare setting or something, what are some of the crucial things to keep in mind?
Well, there are several important management considerations.
Okay.
It's recommended to take a blood pressure reading before any procedure, and then again about 5 minutes after any anesthetic is given.
Got it.
Managing anxiety is also key, as feeling anxious can definitely raise blood pressure.
Right.
So medications to reduce anxiety, called anxiolytics, or sedatives might be considered.
Okay.
Shorter appointments, ideally in the morning, are often better tolerated than, longer, more stressful ones.
Mm-hmm.
Making sure the patient is in a comfortable position in the chair and letting them get up slowly afterwards can also be helpful.
Right. So basically minimizing stress seems to be a common thread here.
You got it.
Okay, and what about when someone's blood pressure reading is really high? I mean, like what do you do then?
I think the sources mentioned something about like urgency versus emergency situations. Yes, it's really important to distinguish between what we call a hypertensive urgency
Mm-hmm.
and a hypertensive emergency.
Okay, so what's a hypertensive urgency?
A hypertensive urgency is when the blood pressure suddenly spikes to 100 and 120 or higher.
Okay.
But there are no immediate signs of damage to organs.
Right.
The person might have a headache, feel short of breath, have a nosebleed, or feel very anxious.
Okay.
In this case, the recommended action is to refer them to their doctor right away, stop any routine treatment, and only address true emergencies.
Okay, and what constitutes a hypertension emergency? That sounds even more critical.
Yeah, a hypertensive emergency is also defined by a sudden and severe elevation in blood pressure to 120 or higher. But the crucial difference is that in this situation, there are signs of damage to vital organs.
Okay, and what would those be?
Well, this could involve the brain, leading to, confusion or stroke-like symptoms, the heart causing chest pain or heart failure, or the kidneys. The management here is even more urgent. You need to call 911 immediately and stop any ongoing procedure.
Okay, so those are definitely situations that demand, immediate and decisive action.
Absolutely.
Now, I think the sources also touched on the use of epinephrine in local anesthetics and how that can affect blood pressure. What's the main point we should understand there?
Well, what's fascinating here is the data showing how even a small amount of epinephrine can impact the body.
Okay.
Just one cartridge of lidocaine with 1,100,000 epinephrine can actually double the average resting level of epinephrine in the blood.
Wow, that's significant.
It is. And if you use more, like 3 cartridges, it can lead to significant increases in both heart rate and the systolic blood pressure.
Okay.
The critical question, as our sources point out, is how someone who already has hypertension or other heart conditions will react to these increases.
Right, right.
It really highlights the need to carefully consider a patient's medical history before even seemingly routine procedures.
Yeah, absolutely. Knowing that even a seemingly small intervention can have a physiological impact is so important.
It is.
Okay, let's move on to ischemic heart disease.
Okay.
But in simple terms, what is that?
So ischemic heart disease is basically a condition where the arteries that supply blood to your heart become narrowed.
Okay.
And this narrowing reduces the amount of oxygen that can reach the heart muscle.
So the heart's not getting what it needs.
Exactly.
Okay. And what are the general signs and symptoms that might suggest someone is experiencing this?
Well, our sources describe chest discomfort that can feel like a range of sensations. It might be pain, pressure, tightness, a crushing or squeezing feeling, a stabbing sensation, or even like an electric shock.
Wow.
This discomfort often starts in the center of the chest, but can spread to the arm, neck, or jaw, especially when the person is exerting themselves.
Mm-hmm.
Other symptoms can include shortness of breath, feeling sick to your stomach, or actually vomiting, a sensation similar to indigestion, excessive sweating, and even fainting.
Okay, so a lot of different ways this can manifest.
It can.
Now, I know the information we have differentiates between stable and unstable angina.
Right.
So what's the difference and how should they be approached differently?
Well, stable angina is generally predictable and often triggered by physical activity or stress.
Okay.
Management for stable angina involves many of the precautions we discussed for hypertension, checking blood pressure before and after anesthesia, managing anxiety with medication if needed, scheduling short appointments in the morning, ensuring the patient is comfortable, allowing for a slow recovery after the appointment, and generally trying to minimize stress.
Okay.
Importantly, elective dental work should usually be avoided, and the patient should be referred to their primary doctor.
Got it.
If urgent care is necessary, making sure the patient is comfortable and avoiding sudden changes in position are key.
Oh, okay.
Now, unstable angina, however, is more serious.
Right.
This includes angina that's getting worse or not well controlled by medication, or if someone has had a heart attack within the past 30 days. In these situations, elective dental care should be avoided altogether, and the patient needs to be referred to a physician.
Okay, so unstable angina, that's a definite red flag.
Yes, absolutely.
What about if someone is actually having an angina attack? What are the signs and how should it be managed immediately?
All right, so during an angina attack, the person might experience chest pain that feels like it's under the breastbone and might radiate possibly down the left arm.
Okay.
The pain usually lasts less than 15 minutes. And if the person has a history of angina, it's often relieved by a medication called nitroglycerin, which they might carry with them.
Mm-hmm.
They might also be sweating, have a faster heart rate and higher blood pressure, be breathing with difficulty, and seem very anxious and worried.
Okay. So what do you do? What are the steps you take?
The immediate steps are to help them sit or lean forward, give them oxygen if it's available, and if they have nitroglycerin, they can take a tablet under their tongue.
Okay.
Usually between 0.15 and 0.9 milligrams every 5 minutes, up to a total of 3 doses. If the pain doesn't go away after 3 doses, or if the person asks for medical help, you should give them a regular strength aspirin.
Okay.
That's 325 milligrams and call 911.
Got it. Okay.
Yeah.
And what about a full-blown, myocardial infarction, a heart attack?
Right.
How do the signs and management differ from an angina attack?
Well, the signs of a myocardial infarction, or MI,
Mm-hmm.
are typically more severe and last longer than an angina attack.
Okay.
The chest pain is often described as a crushing, squeezing, or heavy feeling, much more intense than angina, and it lasts for more than 15 minutes.
Okay.
Critically, it's usually not relieved by nitroglycerin.
Got it.
The person might look very pale, ashen, or even bluish, feel very weak, break out in a cold sweat, feel sick to their stomach, have trouble breathing, and have a sense that something terrible is about to happen.
Oh, wow.
They might also have shortness of breath, cough or wheeze, and their pulse might be faster or irregular.
Okay.
A really important point is that any new onset of chest pain should be treated as a possible MI until proven otherwise. Right. So getting a good understanding of the person's medical history is crucial.
Absolutely.
Now, the management for a suspected MI is to call 911 immediately.
Okay.
If the person is conscious, help them into a semi-sitting position, give them oxygen, and if their blood pressure is above 90 systolic, and they haven't recently taken medications like Cialis or Viagra, you can give them nitroglycerin under the tongue and a 325 milligram aspirin.
Hmm.
Medications like nitrous oxide or morphine might also be considered by paramedics.
Okay.
If the person becomes unconscious, you need to treat it as a cardiac arrest by starting CPR and using an automated external defibrillator, an AED if one is available.
Right.
It's important to be aware of situations where you shouldn't give nitroglycerin, like if their blood pressure is too low or if they've recently used Cialis or Viagra, and also when to avoid aspirin, such as if they have allergies or a stomach ulcer.
Okay, those are really critical distinctions to be aware of.
They are.
Okay, let's move on to congestive heart failure, or CHF.
Yeah.
What exactly is that?
So congestive heart failure, it isn't really a diagnosis itself, but more of a collection of signs and symptoms that indicate the heart isn't pumping blood as effectively as it should
Okay.
to meet the body's needs, you know.
Okay, so it's not a specific disease. It's more of a syndrome, a collection of symptoms.
Yeah, exactly.
Well,
It's characterized by signs of too much fluid, either in the blood vessels or in the tissues, and psychosis, signs that the body's organs aren't getting enough blood flow.
Gotcha. Okay, and what are some of the common underlying causes of CHF that our sources mention?
Okay, so our sources, they list several conditions that can lead to CHF, including coronary heart disease, hypertension, cardiomyopathy.
Cardiomyopathy, that's a big word.
Yeah, it means disease of the heart muscle itself.
Okay.
Problems with the heart valves, inflammation of the heart muscle, that's called myocarditis, infective endocarditis, congenital heart defects, high blood pressure in the arteries of the lungs, that's called pulmonary hypertension, blood clots in the lungs, that's pulmonary embolism, and even certain hormonal disorders.
Wow, so it really is a whole range of things that can lead to this.
It can, yeah.
Okay, and the list of symptoms and signs for CHF seems, quite extensive.
It is, yeah.
Can you highlight some of the key ones?
Absolutely. So some of the main symptoms include shortness of breath, which might happen even when resting or lying flat.
Okay.
That's called orthopnea.
Orthopnea.
Yeah.
Okay.
Another symptom is sudden shortness of breath that wakes you up at night, known as paroxysmal nocturnal dyspnea.
Wow, that's a mouthful.
It is, yeah.
Okay.
People might also experience persistent fatigue and weakness, acute pulmonary edema, which can feel like suddenly being unable to breathe or having a bad cough,
Right.
and feeling very tired after even light activity.
Mm-hmm.
Now, signs that a healthcare professional might look for include rapid, shallow breathing, a specific type of irregular breathing pattern called Cheyne-Stokes respiration.
Cheyne-Stokes.
Yes, swollen veins in the neck, an enlarged and tender liver, yellowing of the skin, that's jaundice,
Right.
swelling in the legs and ankles, that's peripheral edema, fluid buildup in the abdomen, that's called ascites, a bluish tint to the skin or lips, that's cyanosis,
Okay.
unexplained weight gain, and a change in the shape of the fingertips and toes called clubbing.
Wow. Yeah. So as you noted, there's some overlap between what the patient reports as symptoms and what a clinician observes as signs.
Yeah, for sure.
Okay. So given the potential seriousness of CHF, what are the general management considerations in a healthcare setting?
Well, our sources emphasize that for all patients with heart failure, whether they have symptoms right now or not,
Mm-hmm.
it's recommended to consult with their primary doctor before starting any significant dental treatment.
Right.
Other general measures include checking blood pressure before and after anesthesia,
Mm-hmm.
providing supplemental oxygen, considering medications to reduce anxiety or sedatives,
Mm-hmm.
keeping appointments relatively short, and avoiding overly stressful procedures, making sure the patient is comfortable in the chair, and allowing them to get up slowly afterwards to prevent sudden drops in blood pressure.
Okay. Yeah. Makes sense. So, and how does the management differ for someone who has CHF but isn't currently showing symptoms versus someone who is symptomatic?
Okay, so for patients with asymptomatic heart failure, meaning they have the condition but aren't experiencing symptoms,
Mm-hmm.
both routine and emergency dental care can generally be performed.
Okay.
However, for patients who are currently symptomatic with CHF,
Mm.
it's usually best to avoid elective dental care.
Mm.
If they need emergency treatment, it should only be done after talking with their doctor.
Right.
And it's often recommended that these patients be treated in a hospital dental clinic or a facility that specializes in complex medical needs.
Yeah. So basically more precautions for those who are actively unwell.
Yeah, that's a good way to put it.
Okay. Let's move on to cardiac arrhythmias. What are those in simple terms?
Cardiac arrhythmia simply means any change from the normal, regular heartbeat.
Okay.
This could involve the rhythm being off, the heart beating too fast or too slow, or problems with the electrical signals that control the heartbeat.
Okay.
While many arrhythmias aren't serious, some can cause noticeable symptoms or even be life-threatening.
Right. Okay. And what are some of those signs and symptoms that might indicate that someone has an arrhythmia?
So signs that might be observed include a heart rate that's too slow,
Hmm.
usually defined as less than 60 beats per minute, or too fast, typically more than 100 beats per minute, or an irregular pulse.
Okay.
Symptoms that a person might experience include feeling their heart fluttering or racing, that's palpitations,
Hmm.
feeling unusually tired, dizziness, fainting or near fainting spells,
Hmm.
chest pain,
Okay.
and sometimes even symptoms similar to congestive heart failure, like shortness of breath, orthopnea, and swelling in the legs.
Wow. That's a lot to keep track of.
It is. It is.
Okay, so what's the general approach to managing a patient who has, a known cardiac arrhythmia?
Similar to other cardiovascular conditions, the general management includes checking blood pressure before and after anesthesia, considering medications to manage anxiety,
Hmm.
scheduling shorter appointments in the morning,
Okay.
making sure the patient is comfortable in the chair and allowing them to recover slowly after the appointment.
Okay, and what about the difference between like controlled and uncontrolled arrhythmias? How does that impact, the way they should be treated?
Okay, so for patients whose cardiac arrhythmias are not well controlled, it's generally best to avoid elective dental care.
Mm-hmm.
And any emergency treatment should only be done after consulting with their cardiologist.
Okay.
However, for patients whose arrhythmias are well managed with medication or other treatments,
Right.
both routine and emergency dental care can usually be provided safely.
Okay. That's a clear distinction.
Yeah.
All right, let's talk about infective endocarditis. What is it and why is something we need to be aware of, in a healthcare setting?
So infective endocarditis is an infection and inflammation of the inner lining of the heart,
Okay.
or the heart valves, usually caused by bacteria.
Okay.
The types of bacteria most commonly involved are Streptococcus sanguis and Streptococcus oralis, which are often found in the mouth.
Oh, interesting. So it comes from our mouth.
Yeah, it often does, yeah.
Yeah.
It's a concern in healthcare settings, especially during procedures that might cause bleeding,
Right.
because these bacteria could potentially enter the bloodstream and then travel to the heart, where they could cause a serious infection in susceptible individuals.
Okay, so what's the main focus of management when it comes to infective endocarditis, particularly in the context of dental care?
The primary focus is on preventing the infection in the first place by using antibiotic prophylaxis.
Okay.
This means giving antibiotics to certain high-risk patients before they undergo specific dental procedures.
Got
Our sources also offer some general management tips,
it.
such as trying to group multiple necessary procedures into a single appointment
Okay.
to minimize the need for repeated antibiotic use and potential disruptions to blood-thinning medications.
Right.
It's also recommended to avoid sudden changes in the patient's position and ensure a slow and careful, getting up from the chair,
Right. Yeah.
emphasizing the importance of good oral hygiene to reduce the overall bacterial load in the mouth is crucial,
Okay.
as is being mindful of procedures that might worsen gum inflammation.
Got it.
Finally, using a chlorhexidine mouthwash.
Okay.
That's 0.12%.
Mm-hmm.
For about 30 seconds before a dental procedure is also suggested as a way to reduce oral bacteria.
Interesting. Okay, so it's kind of a multi-pronged approach there.
Yeah, for sure.
And who are considered to be at high risk for infective endocarditis and therefore need antibiotic prophylaxis before certain dental procedures.
So our sources provide a specific list of conditions that put people at higher risk.
Yeah.
These include having a prosthetic heart valve, a history of previous infective endocarditis,
Okay.
certain types of congenital heart disease.
Mm-hmm.
Specifically, if the person was born with a heart defect that causes a bluish tint to their skin and hasn't been fully repaired.
Right.
If they had a congenital heart defect repaired with prosthetic material or a device within the first 6 months after the procedure.
Okay.
Or if they had a congenital heart defect repaired but still have some remaining issues near a prosthetic patch or device.
Got it.
Also, people who have had a heart transplant and then develop problems with their heart valves are considered high risk.
Okay, that's a very specific set of criteria, really underscoring the importance of knowing a patient's complete cardiac history.
Absolutely, yeah.
All right, finally, let's discuss cerebrovascular accidents or strokes.
Okay.
What's the underlying problem in a stroke?
So a cerebrovascular accident or stroke is a serious medical emergency that happens when the flow of oxygen-rich blood to a part of the brain is suddenly interrupted. This lack of oxygen leads to damage of brain tissue, and if it's severe enough, the brain cells can actually die.
Wow.
Even strokes that aren't fatal can have long-lasting effects on things like movement, speech, and thinking abilities.
So it can be very debilitating even if you survive.
Yes, it can.
What are some of the key risk factors that can increase someone's chances of having a stroke?
Our sources highlight several risk factors,
Okay.
including hypertension, congestive heart failure, diabetes mellitus, a history of transient ischemic attacks,
Okay.
which are sometimes called mini strokes, or TIAs.
TIAs.
Yes.
Okay.
Or having had a stroke before, being over the age of 75, high cholesterol levels, coronary artery disease, and smoking.
Okay. So a lot of these risk factors are things that we've talked about already.
Exactly. There's a lot of overlap there.
Okay, what are the signs and symptoms that might indicate that someone is having a stroke? I mean, it's so important to be able to recognize these quickly.
Absolutely. Our sources list several sudden signs and symptoms that should make you immediately suspect a stroke. These include sudden dizziness
Yeah.
or a spinning sensation, that's vertigo,
Right.
a sudden and very severe headache, changes in vision, feeling nauseous and vomiting, temporary numbness or tingling, weakness or paralysis on one side of the body, seizures, and in very severe cases, even coma.
Okay, so if you're seeing, any combination of these things, especially if they happen suddenly, it's time to act.
Absolutely, yeah.
Okay, and what are the general management considerations for a patient who has, a history of stroke?